The other challenges that could be really difficult are how do you really help ensure that the work you're doing is making an impact by measuring it, by kind of assessing it continuously and figuring out even out what do you want to define successful engagement as. So it's an iterative process, it's ongoing. What I had mentioned was that we have, for our research projects that we do, we actually have an external evaluation done to help give interviews of patient advisory members, of other team members, of other investigators that come to our work, and they ask what's going well, what isn't, and then that feedback is given to us anonymously as part of the team to help build on what we do and change what may not be working well. And then we also really look towards both process measures, such as number of people attending meetings, number of investigators to kind of show we're growing, but then also outcome measures like what's the value for the patients involved or the clinicians involved or the investigators, how did they feel like that feedback helped change the way that they approach the research, and then things like how do we really ensure it's making a difference in the changes that happen and how that's showing growth or enhancement. And so when we have projects roll up or finish, when we look at response rates for surveys based on usability testing, for instance, is one that we really point to as a really exciting way to help show that engagement really has made a difference. Those are the types of things we're looking towards. But it's an ongoing effort. I think everyone's trying to define how we make engagement successful, but I think we can all learn from each other.
We worked on a survey to be added to MyChart, our version that needs to go out to patients. We worked on a patient intake form, which was a lot of fun. We took it from 9 pages down to 4, and we put it in an electronic form on an iPad and sent it out to a clinic for a pilot. So we've done some things that we've seen make a lot of sense to a lot of people, and we're happy about that.
Yeah, I would say building on that, the idea that when we have specific tools, sometimes those are easier to track than guidance. It becomes more quantitative. So some of the examples we've had do involve things like changes to a patient portal that really had a lot of guidance from our group, and people who actually go through and test the change and make a change from OCHIN's perspective based on what was given us as advice. And then is that making a difference? Are we seeing, maybe not a causal link, but a link that we can at least say is correlated to the fact that you have a higher response rate and people feel like they understand the information better, you're getting less phone calls or questions about the survey, and you're getting information that's more accurate. We have a lot of patients who will say things like, if you include a score of what your risk rate might be for a certain condition and you're asking that and showing them that score, you might have an issue in how people respond accurately. And so do you keep that on the sheet? Do you have that as part of your conversation following the outcomes? And so that's one just specific example that we did based on the feedback from one of our patient investigators. So those are the types of things we turn to. But I think the qualitative work's just as important. How do you capture the value of research from people who are involved as patients, and how do you make sure that those who approach us as investigators take that information, and when they do make changes, that we can track that so we can say there's an impact.
It's going to change your view completely on any project you ever thought about. And it's going to be for the better, not for the worse. It's going to change it to real life, real world analysis, which you really want in the first place, but you never thought about it. And so you got to get patients involved. Make it patient-centered. Your projects are going to flourish. They're going to do well.